They teach you how to be a dentist, but they don't teach you how to be a business owner. When you are in pediatric dentistry, it's double because you're treating the patient who is the child, but you're also presenting information and education to the parent or whoever's along with the child. Twice a year, sometimes a little bit more, really gives us a window into how we can help grow kids' confidences and give them examples of what a healthy medical relationship with a provider and with an office can look like. That when something happens, as the business owner, as the leader, at some level, you have to look at it and understand what your responsibility was in the situation. As a business owner, you have to be able to take yourself out of any kind of victim role. People who recognize that and are drawn to you will stay, and the ones who will not will self-select.
I am here with Dr. Melissa Lopez, founder and owner of Shadelands Pediatric Dentistry. I first met Dr. Melissa, I think almost a year ago. I stopped by to film some video content, and I remember just being super impressed with how warm and nice everyone was in the staff, in the office. I remember seeing kids super excited to say hi to Dr. Melissa, but talking to the other dentists, other staff members as well. And I remember thinking, I've never seen kids so happy to be at the dentist. So ever since then, I've really wanted to talk to you about your journey, what you've learned along the way. I think you have something that's very special here, and I want to let your story get out there. So tell me let's start with how it began. What began your journey, your decision to start your own practice, and we'll go from there.
Well, thank you, Marina, for coming out here, for noticing all of that too, because when you do it day in, day out, you hear, but you don't really think that, it gets noticed by people that aren't in it as much, right? So thank you. And thanks for saying that. I started Shadelands Pediatric Dentistry shortly after moving out to the Bay Area. I'm originally from Chicago and went to school out on the East Coast in Philadelphia at the University of Pennsylvania, and moved out here in 2013, and I started the practice in 2014. So I had been coming out and working at a friend's practice in San Francisco, and realized when I loved it here in California and on the West Coast that I would be staying and putting down roots, and decided to start a practice from scratch. It's my own brand of doing dentistry and working with kids, and centered on making sure that we're focused on being honest. I really feel at my core that when you are honest with people in general, but especially with kids, they can sense that, and it helps them to recognize that they can also be honest with you. And when you're establishing any kind of relationship, at the base of all those relationships is trust. So our focus is always on building relationships out of trust with the kids and with the parents.
So with that being your initial goal when you started, do you feel like you've realized that's remained true throughout your journey?
I have. And the beautiful thing about it is that as my team has grown and as they've come to recognize that that's what works, and they can also feel comfortable to be their fullest selves in the workplace, we give space for those kids and those families to also be able to express themselves in that way.
Nice.
So
that's awesome. Yeah. Congrats.
Thank you.
That's really great. So starting a practice, I'm sure there were things that you didn't expect to run into that were maybe easier, harder, different than you thought it was going to be. Can you talk a little bit about that?
Oh, for sure. Even just going back to what we just discussed, not everybody is used to coming into contact with people who allow you to be your true self. And so one of the most surprising things is that that's not for everybody. There are some families, or mostly adults, who feel that that is off-putting. And so learning to be okay, understanding that your brand, your way of being is not necessarily going to be everybody's cup of tea, and learning to be okay with that is a definite business and life lesson.
Yeah, did that happen right away, or was there a time you were trying to adjust?
I think when you go through dental school, and everyone says this, they teach you how to be a dentist, but they don't teach you how to be a business owner. So when you get out and you're working with people, you start to learn about yourself in the way that other people react to you. And you're also learning what your breadth and what your job scope really is. So it's a lesson that you learn just from practicing dentistry to begin with. So in opening the practice, it took a little turn because you want to make sure that you're giving everybody the best care possible. But what that looks like and how that's presented to people can be different depending on what their needs are, what their awareness levels are. And when you are in pediatric dentistry, it's double because you're treating the patient who is the child, but you're also presenting information and education to the parent or whoever's along with the child. And so it's a little bit of you learn it by trial and error in some instances, and some of it in just learning to be okay on the days that everything doesn't go as great as you'd hoped, right?
As it does with anything you do, but I think especially when you run a practice and a business, there's so much that feels out of your control in a sense, that there's so many moving parts that run outside you, that you're just trying to recenter it all as much as possible. Hold on, we'll pause on that one, Jess. Just mark the timestamp. I was going to ask you with that, do you gravitate more towards being a practice owner or a dentist, or do you feel equally like you identify as both?
I think I am slowly coming to terms with the fact that I am a practice owner. I think at my core and at my heart and why I went into pediatric dentistry was to be able to help children. And, after being in dentistry for 20 plus years, I think that the way that I'm seeing myself and my role in that is starting to evolve a little bit differently. And one of the beautiful things about all this is, after having the practice open for, this will be our 12th year, I had several patients, quote unquote, graduate from the practice this year, meaning I started seeing them when they were 8, 9 years old, and now they're graduating, going off to college. And so they're transitioning to moving into a general dental office. And to hear from those kids the impact that you make on them really helps me to understand how vital our interactions with them are. And the fact that we get to see them twice a year, sometimes a little bit more, really gives us a window into how we can help grow kids' confidences and give them examples of what a healthy medical relationship with a provider and with an office can look like.
I feel like every person a kid comes in contact with during that, just they're changing so much, like really matters. So it seems like, we're just doing their teeth and you're not. You're like a part of their story growing up, which is crazy.
Yes, and I think that now being a business owner 10 years in, I'm starting to recognize that. When you work as an associate, you see that, and depending on how long you stay at the office, you might see that more than others. But when you're invested and you start recognizing that these families have been coming to you for 10 plus years, and it puts an onus of responsibility, but also a level of joy in that you were given the opportunity to be that for someone else.
Right.
It's really beautiful.
Was that something you expected starting this? Did you?
You kind of know it's going to happen, but not as profoundly as I think I'm recognizing.
Yeah, that's really cool.
Yeah.
Are there any main lessons or challenges? You talked a little bit about not, changing your brand to fit everyone and things like that. But if someone were starting a practice today, and now everything 12 years in, what's something you would tell them?
Well, beyond being able to take the highs and the lows with equanimity, that's I think huge in any business, right? Also, COVID happened. I don't think anybody could have predicted COVID. That was a little bit of a doozy to get through on many levels for everyone. I think I think the biggest lesson that I've learned that I would pass on, I was told by a coach that I was working with pre-COVID that when something happens, as the business owner, as the leader, at some level, you have to look at it and understand what your responsibility was in the situation. And it might seem something that is so far beyond anything that you could have remotely done anything to prevent. And yet, as a business owner, you have to be able to take yourself out of any kind of victim role and understand what you could have done in order to continue being the leader and growing the business in a healthy way. And so I think that when you can have the humility to look at yourself and understand where maybe you took a misstep, I think that that will make it safer for your team to make mistakes.
Yeah, I think people look at being a business owner as all the reward that you get from it, but you're also taking on every fire, every risk. It's your job to set every single person up for success, you know, so I think people don't recognize that side of it as much, which hopefully you learned fast, because it takes time, I feel like.
What's fast? It is time. Does time exist?
It's a process.
It's a process.
So you offer things here at Shadelands Pediatric Dentistry that are pretty unique just as services for just what you offer, even in the area, but I would say around the country as well. So can you talk a little bit about that?
Yeah, so my story of how I became aware of airway goes back a really long time, but essentially there is a doctor in Chicago. His name is Dr. Kevin Boyd. He is a pediatric dentist, and when I came out of residency, he was one of the attendings in one of the local programs, and I just knew him from being in the area. And he was talking about sleep and airway as a pediatric dentist. So I've always had an awareness of it, but it wasn't really until 5 years ago or so that I had a personal experience with my brother, who was in his late 20s, and recognizing how his tongue tie affected him and his life in many areas, and how me saying, okay, this field has evolved enough for us to do something about it now. Let's do it. And I went through the steps of myofunctional therapy with him, of tongue tie release through other providers with him, saw how it affected him. And when he came back and told me that I saved his life, it had a really profound impact and really made me think about how, as a pediatric dentist, we are in a very unique place to be able to screen for issues, to be able to ask the questions. And so in the past 5 years, bringing some of those modalities into the practice has really changed the way that I practice pediatric dentistry. And that mainly focuses around my introduction into lasers. Because I looked into lasers for doing tethered oral tissue releases or frenectomies or tongue tie, lip tie releases, that type of a thing, and was introduced to a company called Photona and their lasers. And their lasers are unique because not only are they focused on surgical lasers, but they also have what we call high-level red light therapy lasers. High level is a little bit of a misnomer, but it's different from just red light therapies that you can buy online to have in the house or that other practitioners might use at spas, that type of a thing. These are medical grade lasers, and the way that they work and their effects on the cells and the tissues of the body have really impacted how we can deliver pediatric dentistry and surgical procedures, along with really conservative non-surgical options for everything from fillings, canker sore, treatment, biopsies, tooth extractions.
A lot.
Yeah,
a lot of things.
The list goes on and on and on. It feels a little bit crazy, but I love the science, so.
So it seems like it really changed the way you practice as a dentist and what you're able to, how you approach it. That's really
Completely.
cool.
About 99.5% of the kids that I do restorations on with lasers don't need any type of anesthetic or numbing medicine.
Really?
Which means, I don't allow anyone in the office to use the word shot because it triggers people, but it means no shots.
Yeah.
And it's a really comfortable. And for the younger ones, if we need to, and we use nitrous oxide, which is laughing gas, we can incorporate that. And so, there are plenty of kids that don't need that. And with a laser, need no anesthetic in order to get work done that previously would have left them numb for an hour or two and potentially more after that.
Well, and make them hate the dentist and make them hate, it's not even just that moment. It's then just, I feel like you make a good experience once, it changes it for the rest of the kid's life.
Yeah, I mean, when we're hearing from parents, that was supposed to hurt them so they didn't get cavities again. I was like, no, that's not the point.
I want to scare them into
exactly.
good dental hygiene.
No, thank you.
That's so funny. What was it like introducing extra services like that as a practice owner? Was that hard to navigate?
It was a little bit. I think by now our patient population understands that we are very into the science behind why we do things. This isn't a trend that we're jumping on.
Right.
There are other lasers out there that other offices use that are not using the same wavelengths that I chose to use in the office.
Okay.
And so the experiences can be similar, but I really hold to the fact that these wavelengths not only offer a really non-traumatizing experience, but they also allow us to disinfect the areas. When you're talking about doing medical procedures, I think that when you start shifting your focus on just quote unquote drill and fill and actually start trying to treat as much as possible potential underlying causes, it makes a difference in your outcomes.
Wow. Okay. I feel like, so there's a huge just education piece, it seems like, for parents. Obviously the kids aren't making the decision themselves, so
Correct.
Getting that in front of them to pick what's best for their kids. Okay. No, I love
for hours.
I love how passionate you are about it.
I actually stop myself at any kind of party because I'm like, I will sit here for 2 hours.
That's how you trust someone, though. I feel like when they can do that, you know that they're only doing it for the love of it too. It's not a shortcut by any means.
No.
Yeah.
But it does make for a better experience.
Yeah. That's awesome. So before we finish, is there anything else about Shadelands Pediatric Dentistry that you'd like to get out there that you think people should know about what you do here and how you work?
I think the other modality that I didn't talk about here is that using some of our techniques and even some of the laser work, I've found that we have a way of working with individuals who might be challenged by a traditional dental setting. Okay. In that we can help them feel more comfortable. And that is everything from what you would consider your, special needs child potentially with Down syndrome or cerebral palsy or on the spectrum and whatever range of the spectrum they're in. And it can take a lot of emotional energy sometimes. And yet, once that child is okay coming, it's such a relief for everyone involved.
Yeah, that's probably really rewarding, I would imagine.
Really rewarding. And, for parents to feel like, okay, this is something that so many people have issues helping their children take care of their bodies, that taking that one level out really can make a huge impact. And so we have recognized that we do have a skill with
I imagine that's you, but then you've also worked with your staff as well, just to make the whole
thing. They're great.
Yeah, you have a great staff.
Thank you.
How did you, do you have a philosophy now to picking people to add to the team after 12 years?
The same coach who taught me about myself told me, you just be yourself, and the people who recognize that and are drawn to you will stay, and the ones who will not will self-select out. So I don't sweat it.
Yeah,
if
that's great.
People feel that this isn't the place for them, then that's okay.
Yeah.
It's okay.
What's the future of Shadelands Pediatric Dentistry? What's the goal?
Well, I've been in a shared space situation, so the goal is to have an office that incorporates more space to focus on infant needs, particularly around tethered oral tissues, airway, and some somatic stress release. To expand our airway and breathing center to be able to serve people who are maybe not part of our patient population. Currently, our capacity for that is a little limited given our space right now. And to be able to set up an area that is more conducive to children who are sensory sensitive.
Oh, nice. Okay.
Yeah.
That's great. And how do you feel about all that? Are you excited for it?
Oh my gosh, I'm excited, I'm nervous. It's a lot to undertake. There's a lot of details. I feel a little overwhelmed sometimes, so.
I feel like if you had looked back to where you are today 12 years ago, that would have seemed very overwhelming also.
Oh, completely.
So everything happens according to how it needs to.
I'm trying to really have faith in that.
I love it. Well, thank you so much for sharing.
you.
Thank you for talking with me.
Thanks.
Please subscribe and like and check out Shadelands Pediatric Dentistry at shadelandspediatricdentistry.com.